34.4. This is the last section in chapter 34. After talking about the reproductive anatomy and after that the fetal development, we are gonna talk about the delivery and birth, after birth development. So, physical development continues through adolescence and declines with age. Of course, till reaching adolescence, the development and the growth is very rapid. After that, the growth rate will decline until aging. Let's talk about delivery or birth. The birth occurs in 3 stages. The first stage is of birth is the dilation of the cervix. Let's remember together what the meaning of the cervix. The cervix is the opening of the uterus. It's the mouth of uterus or the opening of uterus. So, number 1, dilation of the cervix. This dilation will help the passage of the embryo through the cervix. Plus contractions. So dilation of cervix plus contractions of the uterus. Contractions, muscle contractions to push the baby through the cervix. What if there is not enough dilation of the cervix? What will happen? Of course, the baby cannot pass and C-section is needed. Stage 2 is the emergence of the baby. Stage 2 in the normal delivery, if the dilation is okay and the baby can pass, it's head first and then the body. So the baby will move through the opening, head first and then the body. After delivery, oxytocin is a hormone that's secreted to stimulate the milk production, to stimulate breastfeeding. Okay, after moving out of the baby, what will happen? As you know, the placenta is inside, still inside. The placenta, what's placenta? Placenta is the organ that connects the baby to the uterus, and it's connected to the walls of the uterus. The contractions will continue after passing of the baby to push the placenta out. And after that, the contraction also will help to control bleeding, to stop bleeding. So placenta detaches from the uterine wall. This is the third stage. After birth, the human will pass through stages of growth and development. What are the key roles of those stages? Genetics, hormones, lifestyle, environment. Those are the rules affecting all stages. So genetics will make one family taller than the other or darker, or one family they have a certain development, mental development, that's different than others. Also, hormones will affect the growth. The growth hormone will affect the height, will affect the bone formation and the puberty. Lifestyle, the lifestyle and getting well nutrients or good food, lifestyle, whether you exercise or not, this will affect also the body's development. Plus the environmental factors, if you're living in a cold area or in a hot area, all those are key factors affecting all stages. So if there are two persons that are twin, you might find after birth, even if they are identical twins but they lived in different environments, they will show different development during the stages of growth. What are the key hormones? Human growth hormone, thyroxine, testosterone, estrogen. Let's talk about the stages. The first stage is infancy. Infancy starts from birth till 2 years old, and the growth is so rapid during this stage. So you will find rapid change in the baby's weight in the first month, second month, great change in the weight and height. The second stage is childhood. The second stage, this is the second stage, which is childhood. It starts from 2 years old till 12 years old, and during this stage you will find great difference in the motor abilities and language skills development. You'll find motor and language skills development. After that, puberty. Puberty starts by secretion of FSH and LH. If you remember, FSH and LH, they play key role in the production of sperms and in menstrual cycle in females. During adolescence, the growth is rapid and the brain rewired. You will find changes in the way of thinking, emotional changes, and also body changes or rapid growth in the body. Then adulthood. Adulthood marks the peak of skills and independence. During adulthood, the peak of skills and independence. After that, aging. Aging is also affected by genetics, hormones, lifestyle, and environment. During aging, you will find decrease in the rate of growth, and the aging symptoms or the effect of aging can be reduced by lifestyle, by getting good diet, by exercise, by reading, continue learning, by improving skills. If you kept on using your brain more and more, so you're delaying the aging symptoms, you're decreasing the effect of aging. So you might find 3 persons, all those persons 50 years old, but the symptoms of aging is different in all, due to the difference in lifestyles, maybe due to hormones, due to psychological factors. There are many factors that affect the aging symptoms.